Hello, and welcome to the training webinar on the use of technology to improve health literacy and health outcomes. Glad you could join us, and we hope you will find this information useful. What comes to mind when you think about health literacy? The challenges and communication barriers stem from many components of health literacy, which are, but not limited to, education, language, ethnicity, culture, experience, lack of experience, and different communication styles. Think about the digital age and how technology has changed the way we experience health literacy today. The purpose of this webinar is to inform the providers and staff of the significant impact of limited health literacy on health outcomes and additional healthcare costs in the United States. The focus is to educate you on the benefits and appropriate use of technology to bridge the gap in healthcare disparities created by limited health literacy. The members who will be providing the information are Eudora Barnes, Supervisor of Intake Operations and former Health Coordinator of Medical Operations, Jennifer Lockmiller, PharmD, Director of Pharmacy, Apichat Wapiso, Assistant to the CEO at St. Mary's Hospital in Thailand, Charlotte Erlun Potter, Senior Director of Information Management, Dustin Rodriguez, Registered Nurse performing in the operating room, and Harry Tran, Division Officer, Naval Branch Health Clinic in Bahrain. Every member brings to this training their own expertise and knowledge to this subject matter. In this training webinar, we will navigate and discuss in detail the definition of health literacy, the impact on the health system, the role providers play with improvement, importance of communication, barriers to communication, and patient-centered focus. We will also examine improving poor health literacy through the use of technology and social media, barriers to leveraging technology for health literacy, data and statistics. First, let's get things started on what is health literacy with Jennifer Lockmiller.
Hi, my name is Jennifer Lockmiller, and I will be discussing the impact of limited health literacy. First, let's define what is health literacy. The Affordable Care Act of 2010 defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. It's important to understand that health literacy is not a static state but a functional state. A patient can move from limited health literacy to functional health literacy with appropriate education and resources to help them make informed decisions about their health. Unfortunately, there is a large problem in the U.S. with limited health literacy. A 2003 National Assessment of Adult Literacy Survey showed intermediate or limited health literacy affects 9 out of 10 English-speaking adults. This means only 10% of adults have the skills needed to use health information that is routinely available in healthcare facilities, retail outlets, and the media. Health literacy extends beyond the basic ability to read and write. It encompasses all aspects of understanding and decision-making to be able to advocate for oneself in the health system. Health literacy skills allow a patient to find health information and services, communicate their needs, process the meaning and usefulness of the information, understand the choices and consequences of health information and services, and decide which services match their needs. Limited health literacy can affect patients of all ages, races, income, and education levels. There does, however, tend to be a greater disparity in health literacy among lower socioeconomic and minority groups. The impact of limited health literacy on the health system includes higher cost of care, greater use of services, and poorer health outcomes. If patients cannot comprehend needed health information, all attempts to improve the quality of care and reduce healthcare costs and disparities will fail. I've provided 3 examples of documented higher cost of care with limited health literacy. In the first study, there was an associated $993 more per hospital admission for patients with inadequate health literacy compared to that of patients with adequate health literacy. A second study that was conducted at the VA between 2007 and 2009 found that veterans with marginal or inadequate health literacy accounted for an additional $143 million spend in this 3-year time span compared to those with adequate health literacy. And lastly, the increased cost to hospitals alone for limited health literacy has been estimated to be $12.6 billion per year in the U.S. Limited health literacy is also associated with a higher utilization of healthcare services. According to the Institute of Medicine, limited or inadequate health literacy is linked to a greater number of emergency room visits. It is associated with a higher rate of hospital admissions, and patients with limited health literacy tend to have lower understanding and reduced use of preventative services. Limited health literacy is also associated with poor health outcomes. One study published in the American Journal of Transplantation screened kidney transplant candidates for health literacy using the Brief Health Literacy Screening. This Brief Health Literacy Screening is an effective tool which asks 3 questions, and they are used to evaluate inadequate health literacy. The study concluded that limited health literacy was independently associated with a decreased likelihood of listing for kidney transplant, as well as an increased mortality once listed. According to the Institute of Medicine, patients with inadequate health literacy are linked to a lower knowledge of medical conditions and report worse health status. So what does that mean for healthcare providers? Well, it is the role of healthcare providers and organizations to help patients understand how to navigate the healthcare system and how to understand their diagnosis and treatment recommendations in order for patients to reach their desired outcomes. We should be embracing technology and the internet to help reach this goal. 80% of Americans have access to the internet. Healthcare providers and organizations must leverage this accessibility to improve health outcomes. Unfortunately, there is an abundance of misinformation available on the internet, and many patients are utilizing this information to make decisions about their health. Our goal is to determine how we can leverage this accessibility to improve health outcomes. This training webinar is designed to answer the question, how can we as healthcare providers help patients embrace technology in order to bridge the gap in health outcomes related to health literacy disparities? Now that we have identified the scope of the problem with health literacy, my colleague Apichat Wapiso will discuss how communication impacts health literacy.
In the previous section, we have already discussed what is health literacy and the impacts of health literacy for both provider and patients. For this section, I am going to introduce and discuss why communications is important in healthcare setting, and also how healthcare provider can use the communication skills to improve health literacy. The research suggests that the relationship between limited health literacy and poor health may be due to poor communication quality within healthcare delivery organizations, so that effective communication and improving communications quality in healthcare organizations is one of the concepts to address the challenges facing patients with limited health literacies by focus on patient-centered communication. First of all, we can all agree that communication is important, but why? Because it's a part of everything we do in medical care and common in healthcare procedures. Good communication is fundamental to good clinical practice, allow us to inform, be informed, and to exchange information. What is effective communication? As we know, communication is an important part of any relationship, but especially between physicians and patients. Effective communication is critical to proper diagnosis, appropriate medication dosing, and ensuring patient compliance with our treatment regimen. Effective communication skills of health professionals are vital to effective healthcare and can have a positive outcomes so that the healthcare providers and organization there is a responsibility to provide effective communication to all patients and their families or caregivers. However, there are a number of potential barriers to impact communications for both provider and patient during the medical procedures and with the healthcare system at large. This includes time constraints for providers and patients feeling rushed. It may be included cultural differences and language barriers, which the difficulty to understanding unfamiliar accents, health beliefs, and values. To improving communication quality and effective communication requires overcoming these barriers. As I have already mentioned, that communication is the foundations in healthcare. It affects every aspect of the health illness, from prevention and health promotion to access and diagnosis of the illness, so that effective communication can improve patient health literacies by using and focusing on the patient-centered communication. Good communication is linked to improved patient satisfaction, adherence to medical recommendations, and health outcome. In the current time, many healthcare professionals believe that communication is more effective when it is patient-centered or responsive to the patient needs, values, and preferences. Patient-centered communication is often described only in terms of individual clinician-patient interactions. Healthcare organizations have a responsibility to facilitate patient-centered communications in all forms, including patient education materials, organizational signage, patient forums, and training providers to be better communicators. For example, the healthcare providers or healthcare organization can implement the new technology to create the patient education material, including social media or any application. In the next section, the next presenter will be discuss how to improve the poor health literacy through the use of technology or social medias. For the summary in this section, that we have discussed the effective communication can improve the health literacy by focusing on patient-centered communication. It is especially important that healthcare organizations use patient-centered strategies to reach the populations that may not receive or understand oral or written health information that is often presented in the limited health literacies. Therefore, organizations can mitigate the effects of limited health literacy by improving patient-centered communication. Now turn to the next section that will discuss how to improving poor health literacy through the use of technologies and social media. Thank you.
In this section, we will review improving poor health literacy through the use of technology and social media. Look at the logos on the bottom of the screen. Do they look familiar? YouTube, Twitter, Instagram, LinkedIn, and Facebook, the most popular of them all. Technology is on today's roadmap to improve health literacy. It's all around us in our day-to-day lives. We briefly discussed how healthcare organizations and their systems play a significant role in ensuring understanding in the healthcare setting. We also discussed ways to improve health literacy and its key to improving health outcomes. In this section, we'll focus on technology and its role in health literacy and outcomes. Research suggests social media and websites can play a role and impact health and wellness. Early findings are showing promising outcomes that social community groups, pages people follow, and postings provide both education and a sense of community for those who have common conditions for many Americans. Lastly, it's important that we discuss some of the ways to properly evaluate these online forums to avoid any misleading information and ads and gimmicks. We want to focus on evidence-based information. The learning objectives are use of social media across the U.S., social media's role in connecting communities and individuals to their health, a perspective on social media and its impact to patients. We will then examine ways that various social media platforms can help patients and discuss a few use cases. Lastly, how to determine credible social media sites. We will provide a framework to do a proper evaluation. Starting with the facts, social media is seen around 7 in 10 Americans across the U.S. today. This research is taken from the Pew Internet and American Life Project focus on social networking. What do the trends really tell us? Well, today 69% of the public uses some type of social media, but who is lacking and has unavailable use? Firstly, we evaluated those who would have the greatest disparity, and it's seen in the age demographic of 65 and older. Next, the second highest variation is for those who have less high school education or no high school education. Next, we see income gap with those who have less than $30,000 a year. And lastly, community gaps is most noticeable in rural areas where people perhaps do not have access to the internet. We did not display race and gender as we noticed almost no variation in those findings. Next, how social media transforms engagement. Just as health literacy can be defined in multiple ways, so can social media. Stated simply, social media is a conversation and a library. Social implies an exchange, and media implies data. Together, they can form a foundation to enable greater health literacy. Social media is not the sole answer, though, for solving health literacy challenges, but it does create opportunity to reinforce messages, build communities, and educate individuals. Healthcare takes a community, no matter if it's fitness, chronic conditions, or serious illness. Care requires community. From the review from HIMSS Health Information Management Systems Society, we'll briefly discuss a few ways that people can get started now and today using social media. One of their recommendations is for patients to find a social community that fits their need and to just jump in, read, interact, ask, and become more aware and informed. For physicians, perhaps create a social voice, write a blog, post a video. 2 paragraphs or 30 seconds can deliver a message for others to consider and explore. For all, spend some time with the people closest to you. Even with social media, having a community at home is important. Social media, though, allows us to expand to our workplace, our neighborhoods, and actually expand beyond our 4 walls. Let's now examine a patient's perspective and the impact of social media on their health.
Welcome to your new world. What's the difference between this one and the one you were in, say, a year ago? You're making your own decisions now, not relying as much on others, and that's a good thing. If you're making good decisions, especially when it comes to things like your health. Now, you might think you're making your own choices here, but sometimes the media tries to influence you. And they can have more of an impact on your health decisions than you might think. Funnily enough, technology has really helped the media get its message to you. We're immersed in it, sharing information constantly. And a lot of that information is sent to us by advertisers. It's designed to influence our choices. So it isn't enough to be good with technology. You have to make good choices, and you need good information. That means not trusting everything you see, digging deeper for the truth. We need to do this because, frankly, the media likes us. They use us as role models. We're trendsetters. And on the flip side, we love media. Most of us will spend 5 months this year just checking out media messages. There are thousands of media channels out there. You see messages in stores, on TV, in your social channels, everywhere. Even when we think we're getting news, we can be getting ads. And they're targeted based on what advertisers know we want. But even if we see an ad, that doesn't mean we'll buy it, right? Well, the media is pretty good at hooking us. Certain messages are designed to trigger certain emotions, and those emotions make us do stuff. Think about how we buy. A lot of times, it starts with an ad. How did that ad make you feel? And did you do anything based off that feeling? Well, somewhere in there, a message got to you, and you started to feel good about it, even if you couldn't explain why. Now imagine your decision-making being influenced like this when it comes to your health. A lot of media is focused on what we eat, we drink, and do. There are a lot of products out there that aren't exactly good for us, but no advertiser would ever say that. Instead, they focus on what we call lifestyle. Having fun, being popular, coming out on top. How many times have you seen products tied to things that are completely unrelated? That's what I'm talking about. For example, let's start with a product that impacts your health. Now let's figure out how they could wrap that product in a lifestyle message. Think of your favorite celebrity in a cool car. Put someone really, really good looking next to them, having a great time, and dang, it looks pretty good, doesn't it? We don't even know what the product is, but we like what we see. And now take a step back. Look at the product all by itself. No celebrity, car, lifestyle. Ask yourself, what do I know about this product? Do I have information on how it could affect my health? Now, how do you feel? Like getting more information before making up your mind?
Now that we've taken a look at a patient's perspective and the impact of social media when they're trying to make decisions, let's talk about where there are some early findings suggesting that social media can be beneficial. The Mayo Clinic has spent time researching, and here are some of their key findings. So starting with Facebook, it's a definite yes when it comes to impacting improving outcomes. In one study from the Mayo Clinic, people looking to lose weight who actively participated on a weight loss support group in Facebook, they posted, they put likings to other posts, lost more weight than their peers who did not engage. Other studies found similar results for smoking cessation. There's 2 billion monthly active users on Facebook. Seems like a pretty good network. Instagram, the photo-based social network group, can make daily chores such as tracking food easier. In one study, participants reported that bragging about their healthy meals to friends and getting virtual pats on the back in return, virtual high five, helped reinforce new dietary habits and ramp up motivation to do better. Twitter, behold the power of the 280-character tweet. Studies show that turning to Twitter in a search of support for healthy lifestyle changes, such as exercising more or losing weight, really works. Sharing a status, just finished a 2-mile walk. Tried this new salmon recipe for dinner, yum. Really can keep you accountable and lets you feel good about your successes. Lastly, one study concluded that people who engage with Twitter also lost more weight. And researchers found people who wore activity monitors, pull out your Apple Watches, how many steps did you get? Those who posted their steps also found their physical activity increased. More information can be found at the Mayo Clinic and on the link below. But before you recommend to your patients, where do you start? We must first evaluate to ensure that the online website has some important criteria and is creditable. Step 1. Evaluate the authority of the author of the web content. Look to see what their credentials are. Step 2. Assess the accuracy and validity of the information. Is it accurate? Are there citations that can be checked to verify the veracity of the information provided? Step 3. Evaluate the currency of the content. Look to see when the last update was made. It should be something recent. Step 4. Assess the relevance of the content to both your needs and your patient's needs. Will this information provide new insight and help with behavior changes? Lastly, evaluate the objectivity in an online website. The purpose of the criteria is to have you think about whether the information provided is objective and limited on subjective findings. Maybe a combination might be okay, but we really want the purpose to be informative. On the right side of the screen, we reviewed a social media site that was found through a Google search. When diving into it and following this criteria, we quickly found the authors were not creditable. There was improper use of English language that created an immediate red flag. And there were some odd postings of people's personal emails and proclaimed doctors who said, "Contact me. I can help you out. Just send me your information." Seemed a little bit like a scam. Yet, what seemed like a credible person had promoted this as being one of the 40 greatest health and wellness Facebook pages to follow. So do your research. Here's briefly some credible wellness sites that you know would be creditable and important. They're supported by U.S. designated health professionals, Harvard Health, Precision Nutrition, Mental Health America, and I'm pretty sure most of you have seen Dr. Oz a time or two. Now let's assess, what have we learned? How can we apply our knowledge to our patients? What social media platform connects people to a community with like-minded or like-diseased individuals? Facebook. Communities can help connect people trying to lose weight, manage diabetes in their daily lives. What social media platform informally supports a feedback accountability loop? Slap virtual high five, Instagram. Participants, remember, reported that bragging about their healthy meal to friends or getting that virtual pat in return helped reinforce new behaviors. Next, what social media platform informally supports accountability by the user? Just finished a 2-mile walk. Tried this new salmon recipe. Twitter, sharing those quick 280 word characters or less. Well done. You now have a few social media ideas that you could leverage to help your patients. Here are the reference from today's readings. Now, we talked about a lot of exciting things. Let's now talk about potential barriers. We want to ensure patients can be successful. I'm transitioning on to my colleague, Dustin Rodriguez. Dustin, go ahead and take it from here.
Thanks, Charlotte. My name is Dustin Rodriguez, and I will be discussing the barriers associated with using technology to promote healthcare literacy. Although leveraging technology to improve health literacy can be useful and beneficial for individuals by making health information more readily available for the promotion of care, it can also have its share of issues and barriers that could potentially make technology use difficult. Growing up in an era of technology, the use of smartphones, apps, and other technology has been second nature to me. But the rapid advancement of new technologies can pose a significant barrier to those who are less familiar with technology, especially those involved from vulnerable populations. For example, as a team member on a project that converted a hospital from paper to electronic health records, I witnessed firsthand how the simple use of a mouse and keyboard was challenging for some individuals who have been practicing medicine using the paper format for 20 plus years. These vulnerable populations include the elderly, the poor, or populations with low resources. A study led by Helen Levy from the University of Michigan found that only 9.7% of individuals 65 or older rated with low health literacy used the internet as a mode to obtain medical information. In another study published in the Journal of Medical Internet Research, researchers found that adults between the ages of 10 and 34 are twice as engaged in healthcare-related internet use than those 65 or older, just outlining how much elderly individuals are being left behind when leveraging technology to improve health literacy and outcomes. Telemedicine is another technology advancement that can be leveraged to improve health literacy. Although its features allow individuals to access medicine from anywhere, it also comes with many barriers. One of the main barriers is cost. The technology associated with operating a fully functional telemedicine practice includes such for equipment, infrastructure, and human capital. All can place a burden on vulnerable populations who need it the most. According to an article titled Solving the Disjuncture Between Research and Practice, although some progress has been made, there continues to be a lack of reimbursement for healthcare services delivered electronically. In the U.S., this is reflected in the modest growth in telemedicine spending by Medicare, the federal health insurance program for the elderly and disabled. One of the most important and crucial barriers in leveraging technology to promote health literacy is data and information. From knowing what data is most up to date and correct to the security of private health information, the exchange of data information can present the most challenging barriers for technology advancement in healthcare. Deciphering between credible sources of information can be challenging to most in today's technology climate. According to a new survey by the Pew Research Center, most Americans suspect that made-up information is having an impact. About 2/3 of U.S. adults, 64% roughly, say fabricated information cause a great deal of confusion about the basic facts about current issues or events. With technologies being serviced from the cloud, security of data plays a direct role in securing the confidence of individuals. The exchange of data information is crucial for health literacy and technology, and with many new security threats and false information being spread, individuals may find it more difficult and be turned away from the impact of technology on their health needs. It has also been challenging for health technology companies to exchange information across multiple systems. While it is a good idea to have information flowing from one system to another in order to get a better idea of an individual's health from a provider and a patient point of view, tech companies make it harder for systems to talk to each other. Now, a couple of things to think about. Does your level of expertise in dealing with and applying technology hold you back from embracing advancements in healthcare technology? I've worked with a couple of providers who will not use a certain product because maybe it's too hard or different for them. Does that have the same effect on you? And also, would a breach of your personal information keep you from using technology more in your health literacy advancement? I know breaches in healthcare and information happen a lot. So would that discourage you from wanting to use technology for information? Now that I'm done, I'm going to hand it over to Harry to wrap up the whole presentation.
All right, thanks, Dustin. Wow, we learned a lot about health literacy and how we can leverage technology to improve health literacy today. Jennifer started off by discussing about how limited health literacy throughout the healthcare system can lead to higher cost of care, greater use of the emergency department for primary care services, and poorer health outcomes. It's important for you, as healthcare professionals, to embrace technology and the internet as effective communication tools to help patients understand how to navigate the healthcare system and ensure that they have an adequate understanding of their diagnoses and treatment recommendations. Like Charlotte previously mentioned, the most potentially useful tool to improve health literacy is through social media powerhouses such as Facebook, Instagram, and Twitter. Social media has the ability to transform engagement by providing a social community for patients to discuss and learn about health concerns. And it provides physicians a social voice to deliver messages for others to consider and explore. Not only can social media be leveraged to foster effective communication, it can also be the answer to providing patients with the motivation and encouragement they need to follow through with behavioral changes. We also briefly discussed how telemedicine can be leveraged to provide healthcare to the most vulnerable populations quickly and efficiently. Unfortunately, the rapid advancement of technology and its use in healthcare has met several barriers, including an aging population unable to keep up with technological advances to gain access to online healthcare-related information. The use of technology also presents challenges such as the cost of equipment, infrastructure, and training. Lastly, and probably the biggest concern when using technology in healthcare, is data and information security. Despite the aforementioned challenges and barriers, the payoff and benefits of leveraging technology to promote health literacy can be astronomical. Barriers will always exist, but if everyone embraces change and works together, we can overcome those barriers and use technology to achieve great things. Our team would like to thank you for participating in our training session today and challenge you to become leaders and innovators in bringing technology to medicine and using it to promote health literacy around the world. Thank you.